Hello, I'm Dr. Hudson from Highland Park Animal Hospital, and today I'd like to get you a better understanding of the term kennel cough. My assistant Sarah will be asking me some questions to help get us a better understanding about the term kennel cough.
What is kennel cough, and how can my dog get kennel cough?
So kennel cough is a term that we use in veterinary medicine to help describe upper respiratory infections that dogs get from close proximity to each other, most often in boarding facilities or doggy daycares, dog parks, anytime a dog has close proximity to each other.
Why can my dog get kennel cough if they've been vaccinated?
Yeah, so the term kennel cough is like I said, it's a slang term for an upper respiratory infection a dog gets in close proximity to each other. There is many different infectious agents that can lead to kennel cough. So some of our more serious ones, such as distemper, canine influenza, parainfluenza, and somewhat bordetella, have vaccines for. Those vaccines are quite effective. Unfortunately, there is some other infectious agents that cause upper respiratory infections that there is not a vaccine for. Mycoplasma being one of the most common bacterial upper respiratory infections in dogs that there is no vaccine for.
Why do some veterinarians give the kennel cough vaccine intranasally instead of giving an injection?
So there's three different types of vaccines for bordetella. That would be the injectable vaccine, oral vaccine, or intranasal. The intranasal vaccine is a unique vaccine that it differs in a bunch of all the other vaccines. The intranasal vaccine will actually stimulate an immune response where your dog would be protected within a few hours rather than the traditional, 7 to 14 days for them to develop their immune response. This is really important for, unfortunately, because our lives get busy, sometimes dogs are not current on their kennel cough or bordetella vaccine at the time of arrival to a boarding facility. And instead of giving the oral injectable form, that wouldn't stimulate an immune response until long after more than likely the dog's gone home, versus the intranasal form has them protected within the first day that they're here.
What are the symptoms of kennel cough, and what should a pet parent do if they notice these symptoms?
So our most common symptoms of kennel cough, of course, is a coughing. Sometimes they will also be lethargic, have a fever, abnormal breathing, not wanting to eat, and just general not feeling themselves. Of course, if you're noticing any of these, I would urge you to seek out a veterinarian's exam to determine the best course of action.
What are the common treatments for kennel cough?
So our most common treatments for kennel cough would be actually an antibiotic. Now, even though some of those infections that were listed earlier are viral in nature, studies have shown it's very common for them to have a secondary bacterial component. The virus will lower our immune system, and then we can get a secondary bacterial infection. Now, of course, if it's primary viral in nature, it's just supportive care, just like in people. We don't traditionally use like antiviral therapy.
What happens if I do not treat my dog for kennel cough?
So anytime a dog has an upper respiratory infection, if you were to not seek treatment, there's two potential outcomes. One of them could be just like if you or I get a cold, we have the potential to get better on our own. The second possibility, which is more concerning, is the upper respiratory infection can descend lower in the airway. That would lead to pneumonia, which is a more urgent condition than a traditional upper respiratory infection. Often requires more aggressive treatment methods, often hospitalization, and unfortunately can sometimes even lead to some life-threatening complications.
Thank you so much for your time in answering those questions.
If you have any questions regarding kennel cough or an upper respiratory infection, please reach out to Highland Park Animal Hospital.